know that they're dying. They know when they're dying. And they can tell you that if you can hear, and that is also true of very, very young children. But in order to understand the symbolic communications of dying patients, you have to understand what the fear of death is. And so I'm going to talk like a psychiatrist only for a minute to talk about this repressed part of the fear of death. In our unconscious, it is very difficult to conceive of our own death. We always believe that it shall happen to thee and to thee, but not to me. Or like a psalmist who says, 10,000 shall fall on thy left and 10,000 on thy right, but it shall not happen to thee. That means, in plain English, in 100 years from now, everybody in this room is a handful of dust, but I'm not among you. And you feel naturally the same way. If you, for example, walk into a room of a dying patient who is your own age, maybe has children like you, for a glimpse of a moment, this forces you to conceive of your own death. And if you are forced to conceive of your own death, you can only conceive of it if something or somebody kills you. You cannot conceive in your unconscious of just getting old, falling asleep and not waking up. It really virtually requires a killer, a murderer. If I would translate this part into one sentence, I would say that the real fear of death is a fear of a catastrophic, destructive force bearing upon me, and I can't do a thing about it. As if somebody would come and drop an atom bomb over here. By the time we are aware of it, it would be too late to do a thing about it. If you believe that for a time being, then you understand the symbolic language that especially dying children use when they try to share with you their knowledge of their own impending death. Patients use basically 3 languages in an attempt to share with you their knowledge of their own impending death. And you have to understand that this is totally irrelevant whether a patient has been told or not told. This is irrelevant of the patient's age or creed or anything. If they have one human being with whom they feel comfortable enough and open and honest enough, if a patient senses that you're not going to play a game, that you do not need to take off the moment he talks about something like this, then this patient will share this with you, and that's when you have your most beautiful moments with dying patients. Nobody better than I think a dying patient knows where you are at. And this has to do with the world of interests for a dying patient shrinks naturally. If you are very close to death, you understand that you don't care a hoot anymore about Mayor Daley, or about Watergate, or about things outside in the world. Your world of interest shrinks to a very small world, smaller and smaller, which perhaps just includes your hospital room, you and your next ones, and perhaps a significant nurse or your doctor or your minister or priest. In this small world of interest where the patient becomes more self-focused, he also sees things in you that he never sees in a noisy, jet-set kind of world. And he can read you, and he knows very, very exactly where you're at. I think a social worker described this better than anybody else when she described an incident when she was assigned to her very first young dying patient, a patient of her own age who was dying. And she was very uncomfortable, and she described afterwards this incident. She said about him, I know he wanted to talk to me, but I always turned it into a little joke, into some light joke or into some reassurance which had to fail. The patient knew, and I knew, but as he saw my desperate attempts to escape, he took pity on me and kept to himself what he wanted to share with another human being.